Hi there, and welcome to another edition of the Ask Dr. Jack Show. I am Dr. Jack Beals, chiropractor in Omaha, Nebraska. We're not here trying to give medical advice, just trying to give you great information you can use to make your life healthy and happy that you can easily find on your own on the internet. To my left.
I'm Malia, Dr. Jack's assistant.
Exactly.
So today we are talking about arthritis. It's a term that's used a lot, but very few people have a true understanding of like what that means for their body and why it causes pain or why it doesn't cause pain.
Now, arthritis, I think, is one of the most overused words in the medical profession. And it's simply because it's just this catch-all, you know. So if you go into your medical doctor's office and you have a pain in your, shoulder or your hands or whatever, they'll take an x-ray and they say, oh, you have arthritis. And so automatically there's this link between pain and arthritis. So let me just show you what arthritis is, because arthritis is a phenomenon you can only find on x-ray. So basically, if this right here is what a normal joint looks like, sorry, there you go. This right here is what arthritis looks like. Do you see how the bone is kind of starting to scale a little bit? And take that to another level, you can see how the bone, really starts to kind of grow like that. That's arthritis. Basically, arthritis describes the fact that there's changes in the joint. The bones aren't quite so square anymore. They're kind of starting to mellow. And I gotta tell you, everybody over the age of 35 has arthritis. I mean, their joints are gonna degenerate. It's just a fact of aging. However, not everybody has the pain that we associate with arthritis. And the funny thing is that, if you go into your doctor's office and he takes a picture of you and you have a joint that looks like this, and maybe you do something and you're changing your diet or do something, anyway, you get rid of the pain, right? Well, does that mean if they took an x-ray your joint would go back to this? No way. No. But yet we still associate pain being because of arthritis, and it's not. There's a lot of people that have joints even worse than this that have no pain, so they have no idea they have arthritis.
So then what's causing the pain for the people that are having pain versus why the other people don't have the pain?
So there's a lot of different reasons why that is happening, and so we're gonna that's the kind of the focus of this newsletter this week, is to give you some ideas on what we can do to change, to decrease, or maybe even eliminate this pain. Basically, what is going on is when you have the pain of arthritis, you've got an inflammatory type of reaction going on in your body for some reason. All right, there's lots of different reasons why. Now, here is the really funny thing. There is a chemical process that has to take place in order for your body to feel the pain of arthritis. And the only way that this whole chemical process can take place is if your body has a substance called arachidonic acid in it. Without that acid, your body can't complete that loop. There's only 5 foods that contain arachidonic acid, and your body cannot produce its own arachidonic acid. So eliminating these foods can almost completely eliminate the pain of arthritis. So here's the foods. The first one is tomatoes, which I don't know if you've thought about your diet, but they're in a lot of things. Pasta sauce, ketchup, barbecue sauce, bacon,
salad,
lettuce, and tomatoes. Salad. Yes, I mean our culture really likes tomatoes. The second one is green peppers, and to a lesser extent, orange and yellow peppers, and maybe some red peppers, but not quite as bad as the green peppers. So that's another source of the arachidonic acid. Eggplant, easy one to get rid of for most people, because nobody really has a super, oh my God, I gotta have it, love for eggplant, that every week you gotta have some.
Except I'm weird.
Okay. Yes. And then another one is cayenne pepper. which, you know, you can pretty easily eliminate that. I mean, it sucks for the people that have spice, but there's other ways to spice up things besides cayenne pepper. The last one is potatoes. And that is a lot worse for people to get rid of, because there goes your potato chips, your French fries, your baked potatoes, your mashed potatoes. I mean, all of that yummy goodness has to leave your life in order for this. But if you do it, and quite frankly, it's not that hard. I mean, there's substitutes for all of this stuff. If you do it, you will find an amazing change in the pain that you are feeling. So those are classified as the nightshade vegetables. So first thing on your list, eliminate the nightshade vegetables.
Okay. And then there's other things that you can do and add to your diet that can help with pain. One that's very important is vitamin D. Vitamin D is important for your immune system, and it also helps with chronic pain because it helps to absorb other nutrients in your body.
The next one is folic acid. It's B9. I know there's a lot of different numbers for it, but it's another antioxidant. It can really do some amazing things, especially when combined with vitamin C and things like that. So it's another one to kind of put on your list.
The other one is glucosamine. They recently did a study that found that it really helped people with rheumatoid arthritis. We sell a great supplement of glucosamine. Just make sure you're actually reading the label on it and it's coming from a good source.
Yes. The next one is a spice, turmeric. Turmeric has a lot of helpful benefits for a lot of things. It's something you could easily put into your diet just by kind of putting a little extra spice on your eggs or in your pasta or whatever. Anyway, there you go.
Some people just take a teaspoon of it too.
There you go. Yeah.
They also, iron is another important one. They found that a lot of people suffering with pain from arthritis are actually lower in iron. So, iron is the one you have to be careful with because you can obviously have too much iron, but iron is another one that could help with the pain.
Next one's fish oil. Fish oil is amazing for so many things. I've got a lot of patients that take a fish oil supplement because it can do so many beautiful things for you. Now, fish oil is one of those supplements that it really matters the quality of it. So getting it at Walmart or Whole Foods or, Walmart or Walgreens or Costco or Osco, all those places, yeah, you can get a bottle that says fish oil on it, but generally speaking, those products do not have the same quality and you will not get the same results. So if you are taking one of those and you're still having pain and whatever, then switch to a better quality brand. Again, we sell one of those here. It's amazing. I know I'm very comfortable with the quality of it, but you can also go to Whole Foods or No Name Nutrition. But, really pay attention to the quality of your fish oil.
The next one is ginger. Ginger root is really good for you, and it's known for its anti-inflammatory properties. So obviously, if you're having pain with arthritis and inflammation, ginger will help reduce the inflammation. And
the next one is cat's claw. Again, it's just another supplement type of thing. It's more of an herb. They just did a big study on this particular herb, and they saw it had amazing effects on the arthritic condition. So another one that you can add in.
And then the last one is one to kind of avoid. Echinacea. Echinacea is really good when you have a cold. It's good for your immune system, but it's not something you want to take all the time, especially if you are struggling with joint pain, because it can make some of those symptoms worse. That's the list of what we want you to take, except the echinacea is another one to eliminate, I guess.
Yes.
Sorry.
The changes that we want you to make. So right now, we are in the middle of our New Year promotion. It's a beautiful time of the year to start changing things in your life, to maybe set goals for yourself to get you to that next level of health. And we have so many ways that we can offer to help you out with that. One of them is a health questionnaire that it's about 600 questions that really does an amazing job of helping people determine what in their life could be better and maybe even find problems that aren't even a problem yet and head it off before it becomes a problem. since you have gotten to this point in our little show here, we want to make an offer to you.
Well, so we're offering the test for free. Just give us a call and let us know. It's usually a $75 test. And it tells you a lot about what the causes of maybe some of your symptoms are. So
Yes, it's really amazing. And so please take advantage of this. You know, it's only through our January promotion, and the January promotion ends on the 20th of the month. So take advantage of it. Call, get it completed, get it back into the office, save you $75, give you an amazing assessment of how your health is going.
well, that's it for this episode of the Ask Dr. Jack Show. Please like, share, comment below, and
Stay healthy, Omaha.